Hey guys, it's Becca from I'm Here Delivery here, and I wanted to talk a little bit about pace bottle feeding. We like to use a pace bottle feeding method because babies pace when they breastfeed, and so we use this method to help babies take the bottle a little bit easier, and because we want to mimic what the baby does at the breast. So this is more of a standard or even a narrow nipple. What I like about a nipple that looks like this is that baby can get on and get a really wide latch. I want baby to almost touch a ring, so a baby's going to look like they're right here when they're bottle feeding. I also have a even flow balance bottle, and I like this nipple shape as well because baby can get a good wide deep latch and almost touch the ring. So the shapes of these nipples allow especially young little babies like our newborns and our babies in the first couple of weeks to get a really good wide deep latch to mimic what they're doing at the breast. There's a couple of different ways you can feed your baby. And so I like to keep baby upright on my knee. Baby looks like their ear, shoulder, hip are nice and straight. And so when we bring the bottle in, I like baby to be up, their neck to be open, and the bottle's going to be horizontal, okay? So this allows baby to pace on their own. If we needed to pace baby, we could just kind of tilt the bottle down a little bit, allow baby to pace. You do not have to remove the bottle from the baby's mouth, but this allows baby to take a quick break and then slightly tilt the bottle back up for a baby. Another position, if this feels really uncomfortable or you feel baby is a little too far from your body, you can actually slide your baby into you like this, bring the bottle here, and still have baby close to you but nice and upright where the ear, shoulder, hip are still really nice and straight. The third position I like to show families is the sideline position. So typically they're laying on my leg like they are here. You bring the bottle in and the baby is pace bottle feeding on their side. So what that looks like in this standpoint would be like this. Bottle horizontal. You can tilt that down if you needed to. So you can still see that baby gets good flow, okay? So this is a really comfortable way to feed baby. This is kind of breastfeeding position. I have some people who will actually even use a breastfeeding pillow to help get baby really comfortable. The other position that I like to show families, bring your knees up, have baby in your lap, and let baby feed. You can sit on the couch, you can be comfortable. This will allow baby to feed and pace. You can tilt the bottle down if needed and then back up into that horizontal position. I also like to preference that pace bottle feeding needs to mimic the time at the breast. So if the baby in the early days is taking about 20 to 40 minutes to feed, I say the average bottle should be about 20 to 30 minutes. For a full bottle feeding, if we're doing a partial bottle feeding, say mom's triple feeding and they're getting half of their milk from the bottle and half of their milk from the breast, then it should be half of that time. So about 10 minutes with a bottle feeding. So we're not wearing a little one out, we're not burning too many calories. The more that the breastfeeding increases when baby gets really more efficient when they get older, then we can definitely decrease the time at the bottle. So if breastfeeding starts to take an average of 10 to 15 minutes, our bottle should mimic that as well.